everyone. I am the Professor M. Kulachandra Singh, Senior Consultant Physician working in the Department of Medicine, Caesar Hospitals and the Research Institute, Imphal. On the occasion of the World Hepatitis Day, I would like to share some facts, do's and don'ts about hepatitis. Actually, this hepatitis is a very common infection caused by a variety of viruses and non-infectious agents. It can lead to various health hazards, problems, and sometimes it can be fatal. And how the hepatitis virus infects patients are actually it can be transmitted via fecal oral route. That is, virus can be transmitted to a patient through close contact with an infected person, or it can be transmitted through close contact like sexual contact with the infected person, or sometimes it can be transmitted via blood transfusion or sharing of needles and syringes. And most of the symptoms a patient develops after infection is actually some patients may develop a mild fever, and it will be followed by loss of appetite and nausea and vomiting. Then there will be exhaustion, fatigue, and pain of the abdomen. And it is usually followed by the development of yellow discoloration of the eyes, that is jaundice, and passing of dark colored urine. And in the management part of the hepatitis, actually there are some specific medications for some viruses, particularly hepatitis B and C. But other virus infections by hepatitis are treated symptomatically in most of the cases. Majority of the cases recover automatically with or without any medication. And in these cases, the role of silymarin is very important. Silymarin helps in the management and the recovery of the viral hepatitis. And for taking these medicines, that is silymarin, one should not take it by its own, that is by self-medication, and it should always be done after consulting a physician for the management of hepatitis. And for the prevention of this hepatitis infection, one should do, say, for example, washing hands with soap and water before and after going to the toilet, and then get vaccinated, and then one should practice safety hygiene to avoid sexual transmission. And one should avoid using, say, for example, personal items used by infected persons, and say, for example, razors, toothbrushes, syringe needles. And when one is infected with the virus, they should not donate blood for blood transfusion purposes. And one should avoid drinking alcohol and avoid traveling to the infected condition and avoid poor sanitation area. And one should avoid drinking alcohol and avoid traveling to the infected condition and avoid poor sanitation area. And avoid traveling to the infected condition and avoid poor sanitation area. And avoid drinking alcohol and avoid poor sanitation area. And avoid traveling to the infected condition and avoid poor sanitation area. All these precautions should be taken to prevent the transmission and infection of uh, viral hepatitis.